For a lot of us, a mammogram is just a routine screening. But its real job, its true purpose, starts the moment that image is taken. It's all about finding breast cancer early, when it's at its most treatable. So let's dive into how experts really turn what looks like a simple picture into a life-saving diagnosis. But here's the thing, it's not always straightforward. This is a tough reality. Even with all the incredible technology we have today, a staggering 10 to 30% of breast cancers can actually be missed on a mammogram. That number really shows you what a massive challenge radiologists are up against. So that's the big question, right? How do these experts find something that's literally hidden in plain sight? Well, it's not magic, not by a long shot. It's a really rigorous method. They rely on three key concepts to systematically uncover even the most subtle signs. And we're about to break down that exact expert playbook for you. Okay, so first things first, let's get a handle on why finding a cancer isn't as simple as, just looking at a picture. The human body is incredibly complex, and these images are just packed with information that can both reveal and conceal the truth. There are really three main culprits at play here. First up, dense breast tissue. It can act like natural camouflage, completely masking a tumor. Second, a tiny error in positioning can mean the cancer isn't even on the image to begin with. And finally, there's just plain old human perception. Even a seasoned expert can sometimes overlook a really subtle clue. And that brings us right to our first, and maybe the most fundamental concept. You have to start with the perfect picture. Absolutely everything depends on meticulous, painstaking attention to technique and positioning. It sounds almost too obvious, right? But this is the golden rule of mammography. You simply can't find a cancer if it's not in the picture. Every single step of this process is designed to make sure that doesn't happen. And here, wow, you can see this principle in action. Take a look at the image on the left. The positioning was just a little bit off, and it cut off tissue deep against the chest wall. A cancer, hiding right at the edge, was completely missed. Now look at the image on the right, taken just 1 year later. With better positioning, there it is, a clear mass that was basically invisible before. This really lays out the difference perfectly. On one side, you've got inadequate positioning, which gives you an incomplete, maybe even blurry picture. But on the other, with proper technique, all the tissue is captured, it's sharp, it's detailed, and it gives the radiologist a clear field to actually do their investigation. So the goal is to hit these technical markers on every single image. The technologist has to capture everything, from the nipple all the way back to the chest wall. The nipple itself has to be positioned just right so it doesn't create any misleading shadows. And yes, compression is absolutely key. It's what spreads out the tissue to give you that sharp, detailed image you need. Okay, so once that perfect picture is captured, the real investigation begins. And this is our second concept. Radiologists don't just randomly scan the image. No way. They use a systematic search, kind of like a detective carefully combing a crime scene for clues. They use what's called a standardized search pattern. You can think of it like a mental grid that they lay over every single image they look at. By following the same path in the same way every time for every patient, they make sure that no area gets overlooked. It's all about discipline and repetition. And this search pattern pays extra close attention to what you might call common hiding spots. Cancers just love to lurk at the edges of tissues, or deep against the chest wall, or even up in the armpit. A systematic search forces a deliberate check of all these high-risk zones. This methodical approach is also the perfect defense against a really dangerous cognitive trap called satisfaction of search. It's this natural human tendency to stop looking once you find the first problem. So imagine a radiologist finds an obvious benign cyst, and then, because of that, misses a much more subtle cancer somewhere else on the image. A strict search pattern forces them to complete the entire survey, no matter what they find along the way. And that brings us to the third and final pillar of detection. It's not just about what today's image shows you. It's about what the images tell you over time. You see, the real experts, they always look back. Because often, the single most important clue isn't something that's just there. It's something that has changed. Every person's breast tissue has a unique pattern. It's like a fingerprint. So what experts are looking for is any deviation from that person's established normal. A subtle new density, a slight distortion that wasn't there last year, that's a huge red flag. Here is a fantastic example. On the left, we have a prior mammogram that looks totally normal. Now look at the current one on the right. Can you spot it? That subtle new area of density. This is what they call a developing asymmetry. On its own, it is incredibly subtle, right? But when you compare it to the prior image, it just pops out. And in this case, that change was cancer. And look, this isn't just a gut feeling that radiologists have. A study in the journal RadioGraphics confirmed it. The detection of cancer is significantly better when prior mammograms are available for comparison. That history is like having a personalized roadmap to a patient's anatomy. So let's tie all this together. What are the big takeaways from how experts read a mammogram? Well, it really all boils down to these three pillars of detection. I want you to think of this as the expert's toolkit. Step 1, the perfect picture, because great technique is the foundation for everything. Step 2, the systematic search, to make sure no stone is left unturned. And step 3, a look back in time, using a person's own history to spot any new and dangerous threats. And here's the crucial point to walk away with. A mammogram is so much more than just a picture. It's really the final step, the culmination of a highly technical, detail-oriented, and expert-led investigation that combines technology, methodology, and history. So now you've got a little window into the incredible expertise that goes on behind the scenes of every single screening. The real question is, how does this change the way you view the process? Hopefully, it brings a whole new appreciation for the skill and the method behind that search for the very first signs.